Nearly 1 in 3 abused children have been seen by a medical provider who did not recognize an injury as abuse. To help prevent child abuse in infants 6 months and younger, the Ohio Children's Hospital Association launched the Timely Recognition of Abuse Injuries Collaborative, known as the TRAIN Collaborative.
The whole purpose of this study is to make it easier for people, pediatricians for example, to identify very early warning signs of child abuse.
The child abuse was a natural fit for the AG to give him and his team confidence that what they would be investing in was going to yield results. And of course, all that's built upon the foundation of our safety work, which was born here in Ohio, our 6 hospitals, plus the Cleveland Clinic, plus Mercy, and now is over 132 children's hospitals around North America. We're changing the way healthcare is delivered for kids by making it safer for both them and the staff and employees who work with us. We're talking about children, and these are our most vulnerable members of society, and oftentimes we're their advocates, the men and women who work in our hospitals, who work in our emergency departments, whether they're the pediatricians, the nurses, or others. When those children come in, we have an obligation and responsibility to give them the best possible care in the world. And without the TRAIN Collaborative, we would be continuing to have misses and potentially devastating stories of an example of where a kid might sustain brain injury when otherwise, were it not for the TRAIN Collaborative, that child was actually helped.
The collaborative is operating in 3 phases. Our first phase was focused on the 6 member organizations of the Ohio Children's Hospital Association. The second phase, we took each of those 6 children's hospitals and we partnered them with a couple regional community hospitals in their area. And we did this because we learned from our baseline data that more than half of infants with sentinel injuries don't come through the doors of our 6 children's hospitals. They present at community hospitals in their region. The third phase of the collaborative we are doing in conjunction with the Ohio chapter of the American Academy of Pediatrics, and we are working with approximately 10 pediatric primary care practices throughout the state. And we think this is an especially important phase because these providers are interacting with infants every day, and we think having them as part of the collaborative will give them an opportunity to both learn from each other and teach each other about their experiences in identifying infants with injury and how to navigate these situations with the families that they see.
The TRAIN Collaborative focused on the identification of sentinel injuries, which are minor injuries that are uncommon to infants. Because they are minor, sentinel injuries are often overlooked by healthcare professionals.
One of the things that we learned from our survey throughout this TRAIN experience was that there is a lot of difficulties with recognition and then further assessment of these patients when they come into the hospital. These changes and differences are even noted amongst some of our highest quality pediatric facilities, such as the ones that are part of this project. I think if you were to compare the two, there would be the people who felt like they weren't getting enough education, so they didn't know what to look for with a sentinel injury. And on the other hand, there were people who were concerned about calling something a sentinel injury that maybe was not.
What I would tell to those providers is that bruise in a 2, 3, 4-month-old infant is trying to tell us that you need to look a little harder to make sure that I'm safe, because these bruises just don't happen spontaneously.
This is difficult for care providers to really incorporate into their care, because after all, they're seeing a young child with an injury, and the provider, the parent, brings them in and says, yep, fell off the bed, I'm just bringing him in because I want to check and make sure there's nothing else wrong. And we don't naturally begin to think, oh my goodness, maybe there are other injuries here.
I think the first step to helping improve recognition of sentinel injuries or injuries that are concerning for non-accidental trauma in these young infants is education of the providers who are encountering these young infants. Educating them as to how child abuse presents in young infants and to what the appropriate approach should be in the evaluation of these young infants for additional injuries. Participation in TRAIN has increased awareness of providers regarding the importance of recognizing these small injuries in young infants as concerning for non-accidental trauma, and in the uniformity of the approach to evaluating these children, such that all children that present with such injuries have the same screening for additional injuries done.
when we think about the future of TRAIN, I think figuring out how to better collaborate with these other systems of care that interact with these children and help care for these children is going to be critical. I think there's tremendous opportunity there. And we're finding that the same educational gaps that we have as pediatricians, they're shared by our colleagues in child welfare and law enforcement.
I truly believe that the impact is going to be not just on the kids in Ohio, but frankly, kids across the country. The data that they're coming up with certainly can be used and can be helpful to pediatricians from one end of the country to the other.
To learn more about the TRAIN Collaborative, visit ohiochildrenshospitals.org/how-we-collaborate.